I'd like to welcome everyone to the July 2nd Council Informational Meeting, and we'll begin with a staff report by Deborah Owen.
Thank you, and good afternoon, Sioux Falls City Council. Just a couple of updates just to keep you informed, and that was at the request of the council chair regarding executive orders. There has been one that's been put out from seatbelt usage. It's really just, it's not many changes, and actually is just an update. Also, the exposure to bloodborne pathogens is another executive order, and I won't even pretend to understand I know about all of what that even means, and certainly isn't a part of the day-to-day business at the Carnegie. However, there is a city travel policy executive order, and there is, it does actually state that that employees under the city council will have their travel approved by the city council chairperson. And I just wanted to let the council know all travel that is done by myself or other council members has always been approved by your chair, but the audit committee actually, through their set of procedures, they actually approve of the internal audit travel. And so that's just a little bit of a difference there, just so you know procedurally that they actually approve of the audit travel policy or business. And also, just to let you know that Tamara is here, and we've done some updates and changes in our procedures in our office in the interest of being more efficient and productive. And so I'm just going to let her explain a little bit about that procedure.
Thank you, Deborah. Hello, Council. I have some colored folders in front of you that have a cover sheet and some backup documentation that illustrates the clerical changes we've made in our office recently. We have merged two existing forms. Item 1 is the existing agenda approval form and directions. Item 2 is an existing informational sheet, which is an internal tracking mechanism for the city clerk's office for monitoring council action. And item 3 is a result of the merger of the two existing forms. We are hoping that this item will be released via an executive order in the near future so that we may implement it, and we're hoping to do so in the beginning of August. The main advantage of merging the two forms is to reduce repetition in the office and to improve office efficiency. In doing so, we are saving 8 hours a month of clerical time, which comes out to 96 hours a year, which is 12 days. This will result in a savings for the city clerk's office in the first year of $1,739, and in each additional year, it'll be $1,926. The only disadvantage to merging the two systems is we purchased Adobe software for $183 for a one-time cost that will allow us to use this information by documenting the PDF and updating the PDF with the typed information. There's no additional work required of the administration to use this form. It changes to a landscape format versus a portrait format for them, but it doesn't require any other changes. Are there any questions?
How much paper will it save?
How much paper will it save? Well, we had to do an informational sheet for every single ordinance and every single resolution that's on an agenda. And we've had some agenda items that are 56 items, 62 items. And while that isn't all ordinances and resolutions, it does come up to quite a bit of time.
Any other questions, Tim? Gerald.
I just want to make a comment. We appreciate your conscientious review of these forms, and for you to save some money is important, and I appreciate the fact that you are aware of those expenses. So thank you.
Thank you.
Thank you, Tamara.
Thank you.
At this time, Mike Cooper has a couple of items he'd like to share with us.
Mike Cooper, Planning and Building Services. I wanted to take an opportunity today for a real quick overview of a special project that's currently in the works out at the Convention Center. And this is a project that was initiated by the Arena and Convention Center Board. And the idea is to solicit donations to have framed photography placed in the meeting room walls that would depict major attractions around the Sioux Falls area. And I want to go through this real quickly to give you an idea of what this project will entail. This is, go ahead. We've developed some guidelines, and again, this is all going to be done privately. There will be no city funds involved. And we've come up with some guidelines that will have approximately 20 of these photographs displayed on the meeting room walls. The sponsorship fees would range between $1,500 down to $500, depending on the size of the picture, and each picture would be displayed for a period of 5 years. At the end of that time, the picture would be the property of the City of Sioux Falls. Next. The pictures will depict different scenes around the city, and we've reviewed these with the board to get their input of what type of themes or focus they would like to see. It varies from the Cathedral District, different park areas, downtown activities, Yankton Trail soccer, and then also some historic photos. And we're also working on the Great Hall, the Pavilion, the Orpheum, and the Zoo. And there are obviously other topics that we could eventually incorporate into this project. The meeting room walls, we've identified potential locations for these photographs to be placed. And as I said, they would be professionally done, framed. We've been working with Larry Rayfeld from Rayfeld's Framing on how this project would be moved forward. And then just quickly some scenes of potential examples of what these photos would look like and where they would be placed within the meeting rooms. And then as we get to the end, we'll have the historical photos. So we would like to move forward with this process. It's our understanding that since these are photos, they would not be under the guidelines of the Visual Arts Commission and then final approval by the City Council. But I just wanted to make sure that was your understanding too as we would move forward. I think we're going to be very successful in getting sponsorships for these. In fact, we've already been contacted by some folks that would like to move ahead. We would like to implement this yet this year if possible. The second part of this is a special actual piece of art that would be displayed in the main foyer of the convention center, and this is going to be called a termosphere. Dick Termos is an artist based out of Spearfish that has done projects like this around the country. This would be a 4-foot diameter globe-shaped piece of art that would depict historic as well as current scenes from around the City of Sioux Falls. And this piece of artwork is proposed to be funded through a donation by Avera McKinnon Hospital of approximately $45,000 as a gift to the City of Sioux Falls. We are working with the Visual Arts Commission on this, as well as the Arena Convention Center Board. Both of those boards will be making recommendations at their July meetings, and then we would come back in August to the City Council for your approval as far as the placement of this piece of art within the Convention Center foyer. This is going to be a very unique piece of art that will be part of the 10-year anniversary of the Convention Center, and we're pretty excited about that. So both of these projects, the photos, the termosphere, are all going to be done through private donations. This will be coming to you for formal approval. We did not anticipate having to bring the photos to you for your formal approval, but we can certainly do that if that's your desire.
Any questions of Mike?
Thank you for the time.
As far as I know, there's nothing from the Audit Committee unless you have something, Rich. Fiscal Committee?
Immediately following this meeting, we will be going through the council budget in the overflow room.
Land Use?
Nothing to report.
Public Service?
Yeah, we had another meeting today dealing with campaign reform. We're going to see if we can just have 2 more meetings and kind of wrap this up, but that's just kind of tentative right now.
Okay, thank you. City Council, open discussion? Anything to come before the council for open discussion? If not, we'll continue with staff report, the USD and Falls Community Health Partnership. Judy Buseman will give us a little rundown.
Thank you. Sent some information to the council previously on a couple of occasions, but as we're moving toward first read of the ordinance tonight, I wanted to have a chance to discuss any questions or points about this particular partnership. The ordinance, as it's presented to you tonight, establishes a lease for space within the expansion space of the current community health center in the new building. We've been talking with USD and with and actually they've been talking then with the Delta Dental Philanthropic Fund, and I have representatives here who will also want to identify their support for this project. Scott Jones, CEO and President of Delta Dental, and Ann Brunick, who is the chairperson for the dental hygiene program down at the university. This lease would be a 10-year lease for the space that would, and the initial construction would be paid for by the city. This project came up as we look at oral health services within not just the city, but within the state. There's been a concentrated effort since around 2000, 2001, but directly after 2002 to really look at oral health services in South Dakota, because there had been a persistent ability of Medicaid clients and Medicare clients to receive services in oral health. And as the Dental Association, the Community Health Center Association, and both Delta Dental and the university sat down with about 50 participants in 2002 in a summit, there was a concentrated effort to look at how do we expand services, particularly for Medicaid children, but also for other clients around the state, because as we looked at the kind of chart of dentists, they were all aging at the same time, and so there was going to be a baby boomer issue. So there have been many efforts around the state looking at how do we influence the number of people going into dental professions, but also then efforts on the service side. And we've probably heard of the Ronald McDonald van that comes to town, but they're also looking at ways to expand the way services are delivered, where there's some ability to do dental exams and dental varnishes in clinics. So there's been many of this, but this effort also has had discussions like the one we've had with the university on a partnership here. And as we've looked at the construction process for this area, we would be constructing that area just as if we were expanding our clinic. It would be constructed to the same specifications we're using currently in the clinic, and with workspaces that would be available. So this is more like, I would call it a partnership rather than a lease, because these two programs will look seamless to clients as they call in. It would be where is there available resource on the particular day and appointment needed, and we'll be using similar charging philosophies, and so that to the client it will look seamless. They could be coming up here. They may be served by one program or the next. We'll do our own billing. We'll exist as two entities, but it'll be the same waiting room, the same services as we look at doing that. The initial plan is to begin construction in August with services to start in 2008. The University of South Dakota would be responsible for all the expenses that are associated with its program. They will also pay for the utilities and maintenance, facility maintenance in that space. The Delta Dental Fund, Philanthropic Fund, has agreed to pay back the City of Sioux Falls for those construction costs with a 6% interest over 10 years, with the first annual payment being January of 2008. So again, why is this a good piece of work and a good partnership? Again, I think it's two governmental entities coming together to do what they both do. One, we provide a low-cost service. The dental hygiene the School of Dental Hygiene also provides low-cost service. By co-locating, we really target the clients that really need this service. We're targeting the Medicaid client. If this were in another storefront, certainly other people may be looking for that discount. This way we targeted to people, and it's a one-stop shop for those clients. If they need services beyond those that are given at the university dental clinic, then we would give that expanded restorative care that might not be done by their dentist. Again, why is this a good deal then for the City of Sioux Falls? As we look at services need, we have way greater demand for our service than we can possibly provide. And I look at, for citizens of Sioux Falls that are seeking that service, the difference in getting a quality education can be the fact that I have children in my class that have dental decays and they're in pain. So the difference of getting the same degree of attention in the classroom can be taken care of by school. I think the other one that I have is for other citizens, because we have many adults also. If you look at the success of a job interview can be just their dental hygiene and their dental abilities. Those are important factors on that first impression when you go in on any place. So for people who are suffering from that kind of disease, this is an important service that they seek, and it's very limited at this point in time. Again, as I mentioned, the space design is as if we were going to move into this service. So should in 10 years the USD move out, we would be able to utilize this as just an extension of the same area. Maybe with all of the efforts of this Oral Health Coalition, we'll have this problem out of the way in 10 years. But if not, there'd be the ability. There will not be an expense to the city operating budget. At this point, again, we have two governments coming together to do the things that they do, the clinical experience and low-cost dental care. So that for the city budget, there's no hiring of additional staff, and we'll be more than doubling our dental abilities to provide dental hygiene. Currently in our clinic, we have 2 dentists and 1 hygienist. I don't know about your dentist's office, but mine that's usually a 1-to-1 relationship. But again, when we're looking at what we were providing at the time, that was the way we went into this service. So this is an extension of dental hygiene in the community that we would not have otherwise. We also, in this lease, are retaining the ability to, this is a university program, and they go more like 10 months a year rather than a 9-month program that we think also. But we will have the ability in this lease to utilize that space because we have dentists that would volunteer their time, and in fact we have some now, but we don't really have very many operatories open. On the half days that we have a dentist gone, or if we're on vacation, we have some dentists that will come and volunteer do space, because dentists are very aware of this issue for Medicaid children or for Medicaid clients. This will allow us to have expanded abilities to do that also. In the lease agreement, I think if you can answer any questions, but the highlights are, as I've identified, the construction costs will be upfronted by the city. They will be paid on an annual basis over 10 years through Delta Dental Philanthropic Fund with a 6% interest. USD will be responsible for the maintenance and the utilities on those costs. In our ordinance, we have asked for a shortened posting on this, and this would be according to state law, and Gary can go into that, but this came up at our June 20th, the contractor, at a meeting with the contractor. He identified that we would have severe business disruption if we tried to work because of the kind of core drilling that must be done for operatories. If you think about your dental chair and all its connections for water, vacuum, all of the connections that must be done. He identified that in this building, that as they've done the other drilling now, as they're putting in our dental chairs, nobody really would be able to conduct business in an ordinary manner, even as large as that building is. So he recommended to us that we needed to put in process a way to let him get into that building and do that drilling prior to. So this is why we've asked for the shortened posting time by the second portion of that ordinance, so that we could have that not disrupt the 100 staff and over 200 clients that will be in those buildings for the 6 days he needs to do that kind of drilling. With that, I can take questions, or if we let Scott and Ann just give you a couple of minutes.
Questions of Judy? Pat?
Judy, I just have a couple questions. So the total cost, the construction cost, is going to be what?
$233,000 is what it's looked at right now.
Okay.
This was printed, you have the current version, and I have the signed version now that Ann brought back with me, as Dr. Abbott was in the back, and we had it back with him. So.
Okay. And the lease amount is going to be how much?
The lease amount would be that extended over annual payments, and I didn't bring that with me. I'm sorry. It'd be that.
So that amount divided by 10?
Divided by 10 years, and then with a 6% interest for each year.
Okay.
Gerald?
Judy, the construction, and first of all, this is a great program. I appreciate the fact that we're expanding it, so I thank you for your work and for the support of the other partners. My only question is when the building is being built, this has been a joint county-city project. How does that affect our relationship, or how does it affect the county's rebate, if you will, on the lease of the space that's going to be used by the dental program?
County's rebate.
Well, it's not a rebate, but frankly, it's income generated that the county hadn't recognized before, and we're building a building jointly with them.
This has always been identified. I mean, in the beginning of this lease space, and Gary might be able to speak to the cooperative agreement better than I, but this would be the way we've been working this through with the county. They've been well aware of what we've been doing with this piece, so they've not expressed any concern to me. As we laid the the footprint out for all of the entities as in the building. This was identified as our space from the beginning, so we aren't taking on a different piece of the footprint. So we've always been responsible for the the construction percentage, et cetera. Now, this wasn't finished out space on that, but that's why the entire cost of that finish out now is what we're talking about.
So the county, in the agreement, if you will, is aware of the fact that we are adding to the total construction cost of the project?
That is correct, but these will be 100% city costs because it's within the city designated area. It really should change nothing regarding our arrangement with the county.
Right.
Thank you.
They are also aware of the drilling noise and are hopeful that we consider that.
Any other questions for Judy? I guess one thing, I assume it'll be require a supplement to the budget for the $233,000?
Actually,
and then a change order to the contract?
A change order to the contract, but there is that amount of money within the CIP fund, so there isn't any adjustment that need to be done. So it really is just the signing of the lease. But I'd like to introduce my two partners here as collaborators. Ann, if you want to just ask them to say just something so you get to know who those partners are and why they're here with us.
Hello, Ann Brunick, the chairperson of the USD Department of Dental Hygiene. I'm very happy and grateful to be part of your meeting today. Thank you for allowing me to come. But I am very excited about this opportunity that we have. Looking forward to a partnership. And I'm grateful for Ms. Jill Franken, Ms. Judy Boozman, Gary, for all of the work that's been done so far. We think this will be a great opportunity to be able, as Judy mentioned, expand dental services to those folks who need them, those who may have access to care issues, financial constraints, or those just without the ability to find a dental home. So we're looking forward to being able to help those folks in this community. We also look at this as a way to enhance our own dental hygiene program. This is an opportunity for us to expand our facility. However, we have been working in partnership with the Falls Dental Clinic already. Our students have been rotating with Ms. Lana Jones, the hygienist there. And they have found that to be a very wonderful experience. Our accreditation agencies require that our students have so many hours and so many kinds of patients and so many opportunities. And this is one that especially gives us a great range of ages and race and cultural diversity, which we have appreciated so far. So we look forward to this partnership and hope that it will be a very long-standing one. Thank you.
Any questions? Thank you.
I'm Scott Jones, and I'm the president and CEO of Delta Dental of South Dakota, and we're located in Pierre. Delta Dental is a nonprofit dental service corporation. We've operated since 1963, and our mission is to improve oral health. We do it primarily through employer-based groups, much like the city employees, which we've administered for several years. But over the last decade, we've become more and more involved in trying to figure out ways that we can help improve the oral health of all South Dakotans, not just those we cover. We operate and subsidize the Ronald McDonald Caremobile, which makes about 10 to 12 of its 40 weeks a year here in the Sioux Falls area, serving a lot of the same folks that will be served at the Falls River Community Health USD partnership. We have a loan repayment for young dentists to encourage them to return to South Dakota and to open their practices to underserved populations. And we see this project as just another good way of collaborating with others to figure out ways we can get oral health services to those who need it, plus to enhance the educational experience of those dental hygiene students. We don't have a dental school in South Dakota, but we do have a dental hygiene school, and if we can make it an even better asset in improving oral health for South Dakotans, we're eager and happy to do that. and we thank you for the city's involvement and support of Falls River Community Health Center. It's a tremendous asset to those folks who have the most difficult time receiving care, and we hope this partnership will enhance their ability to receive oral health services.
Any questions? Thank you very much.
Thanks.
Anything else to come before the council? If not, we are adjourned till 7 o'clock.
Okay.